Hello, good morning. Let's do NMC CBT book together. These are best book. Trust me, after going through these books and MCQs, you will pass in first attempt. Lots of students done in previous, so you will do as well. So I will read book for you and you just need to listen whenever, wherever you have time. Just take your headphone and listen. Let's start reading book together. So let's start. The first topic is abuse. Let me read it for you and then you just grab it and what is abuse? Abuse is when a person hurts another person, either physically, sexually, or emotionally. It can happen many times. As such, it becomes a pattern. It often continues until the person who is being abused get helps. Sometimes a friend, family member recognize the abuse and intervene to help. What are the classification of abuse? It includes domestic violence, rape and sexual assault. What does abuse and neglect of vulnerable adult means? It means that most of the time older adults are vulnerable to abuse and neglect, especially if they have care needs. So this is important. What are the warning signs of abuse? Number 1 is neglect. The example of warning signs of abuse are denial of visitors, withholding food, drink, medication, failing to provide their needs. And warning signs are weight loss, bed sores, soiled clothing, complaints of pain or discomfort, dirty or unsafe environment, lack of communication. Then physical. Examples are pushing, hitting, shaking, kicking, grabbing, and pulling hair, rough handling, force feeding, misuse of medication, and inappropriate use of restraint. And the warning signs are unexplained injuries, bruising, unwillingness to seek medical care, changes in the adult's behavior. Psychological and emotional abuse. The examples are threats to harm, abandon and neglect, deprivation of context, humiliation, blaming, treating someone like a child, threats, intimidation, and coercion. Warning signs are high blood pressure, low self esteem, lack of confidence, depression, or withdrawal. Lack of result in others, the adult covering in the presence of the abuser. Sexual abuse are being forced to watch pornography or to someone who is in the act physically. Rape or sexual assault. Warning signs are pain, irritation, or bleeding in the intimate area, difficulty in walking or sitting, torn, stained, or bloody clothing, STIs or pregnancy. Financial abuse are withholding money or possessions, theft, fraud, scamming, borrowing money or not repaying it, pressure on wills, deeds, on inheritance. Warning signs are unexplained, inability to pay for bills or shopping, etc. Withdrawals of large sum of money, inability to account for spending, worrying about money, losing money or possessions inexplicably. Discrimination, harassment or maltreatment because of the person's race, gender, disability, age, faith, culture, or sexual orientation. Bullying threats on unequal care. The warning signs are person being used as a scapegoat, denial of access to services, to other service users, lack of respect for their religious faith. And the last is institutional. Poor practice, These are all abuses, poor practices, policies, or procedure within a residential home, hospital, or daycare center. Routines may be insensitive or don't take into account the unique need of each person. The needs of a staff are prioritized above the service user. Use of restraint or sensory deprivation. Example, hearing aids are not used. And what are the warning signs are? No flexibility in the bedtime or working routine. Adults being left in the toilet or commode for a longer period of time. Inappropriate care for the possession or living area. Lack of clothes or possessions. Inappropriate use of medical procedure. People being spoken to or referred to disrespectfully. So, what are the response of these abuses? Respond when warning signs are present. Respond sensitively to disclosure. How to report a concern. This is important as well. Download the cause form concern from the safeguarding web page and request from your project coordinator as soon as possible. Complete the form, sign and date it. Give the completed form to your project coordinator or hub staff within 24 hours. What are the details to include in this abuse form? Include your name and the project you are volunteering on, name of the alleged abuse and their relationship to the adult, your concern and your action taken, the date, time, location of the disclosure or observation. No detail of all the vulnerable, example, age, address. Observation to support cause of concern. Our next topic is abrasion. So, what is abrasion? Abrasion is a damage or scrap area of a skin, usually over the bony prominences of the ankle, knee, hip, face, or elbow. Ankle, I repeat, ankle, knee, hip, face, or elbow, or rip of skin. What is accountability means? Accountability means that individuals are responsible for their action and may be asked to justify them. Responsibility means being answerable for one's own action. The NMC 2008 state that, this is a quote, nurses and midwives hold a position of responsibility and other people rely on them. They are professionally accountable to the NMC as well as having a contractual accountability to their employer and are accountable to the law of their action. This one is a main. This always comes in the MCQs. You must provide a high standard of practice and a care at all times. That's definitely comes. Use the best available evidence. You must ensure that any advice you give is evidence-based. If you are suggesting healthcare products or services, you must ensure that the use of complementary or alternative therapies is safe and in the best interest of those in your care. Keep your skill and knowledges up to date. Ensure to update your knowledge and skills within the current evidence-based practice. The second from this book, NMC review of the NMC CBT, GAML review for the NMC CBT test. This is updated edition and we are reading the CBT book. So the next topic is acid respiratory failure. Acid respiratory failure is a disorder associated with acid respiratory failure are hypoxemic and hypersonic. In hypoxemic, we can find them pneumonia, pulmonary edema, pulmonary embolism, and heart failure. Whereas in hypersonic, it is CNS depression, neuromuscular disease, acute asthma, chest trauma, pneumohemothoracic, tension pneumothoracic, and spinal cord injury. What are the clinical manifestation of acid respiratory failure? What you can see, or you can say, what are the signs and symptoms of the acid respiratory failure? So, the first one is change in the level of consciousness or restlessness, tachycardia, tachypnea means hypoxemia, orthopnea, hypertension, bradypnea, या hypercapnia, and the diagnostics are arterial blood gas, chest x-ray, CBC, sputum culture, and blood culture. And the last is electrocardiogram. What is the advanced directives? Is advanced directives mandatory for all patients? No. Why is advanced directives important? It allows the patient to state how or what care they do to receive if they become unable to make decisions in the future. So, this is called advanced directives. Advocacy service. What is advocacy service? So, these are all the definitions from the CBT which we are learning now. Yeah, so what is advanced advocacy services? What is advocacy services? It helps vulnerable people access to information and services. They are encouraged to be involved in decisions about their lives, explore choices and options, defend and promote their right and responsibility, and speak about issues that matter to them. Now, the another is airborne precautions. So, the next important definition is what is airborne precaution? State the airborne precaution. Patient should be in airborne isolation, infectious negative pressure room. This is very important and it is hard to understand. So, patient should be in airborne isolation, infectious negative pressure room. Wear N95 respiratory mask, which is more suitable than other types of mask. Limit patient movement out of the room. Indications for airborne precautions are tuberculosis, varicella, chickenpox, rubella, smallpox. Please note the patients who are severely immunosuppressed, example cancer, HIV, organ transplant, are placed in a private room with a positive pressure airflow. Therefore, wear N95 respiratory mask, gloves, and gown before entering the room. So, our next definition is airway obstruction. What are the causes of airway obstruction? Airway obstruction is a partial or complete blockage of a breathing passage to the lungs. What are the causes of this? Presence of foreign matters, allergic reactions, infection, anatomical abnormalities, and trauma. What are the signs of oropharyngeal cancer? Persistent sore throat, difficulty in swallowing, earache, difficulty in opening mouth, change in voice, lump in the neck, painless mouth sore. Now we're going to read the definition of the anaphylaxis. What is the anaphylaxis? These are all the definition comes in CBT test. There are 100 questions, so it's better to read everything and understand everything. So let's continue with what is anaphylaxis. Anaphylaxis is a severe and potentially life-threatening reaction to trigger an allergy. It develops suddenly and gets worse. List out the symptoms of anaphylaxis: dizziness, dyspnea, wheezy, palpitation, anxiety, angioedema, and loss of consciousness. The next thing is, what do you do if anaphylaxis emergency situation take place? Call 999 or an ambulance. If trigger is found, remove it from skin. The person should lie down flat, side away or sit up, pregnant or while breathing with difficulty on unconscious. Let me read this again. The person should lie down flat, sideways or sit up, pregnant or when breathing with difficulty or unconscious. Use adrenaline if you know how to administer. Repeat injection after 5 minutes if symptoms did not improve. Adrenaline auto-injectors are EpiPen, Emerade Jet. These can be very helpful in minimizing the effects of this allergy. How should someone experiencing anaphylaxis position? So for pregnant women, they need to lie on their left side or a left lateral position. I hope so you can see it, yeah. And for someone with dyspnea, place on flowers position. For an unconscious patient, should be placed in the recovery position. So our next topic is antibiotic administration. Again, we are reading all of the definitions from this book, and we are covering from A to Z alphabets. So we have already started the A. Today we're gonna finish the A. If you like the video, please comment, like and subscribe. So I'm gonna do all of the book together, and we're going to do the MCQs as well. So let's go again for the antibiotic administration. So what are the indications for antibiotic administration? What are the indications for antibiotic administration? Wound that are already showing signs of infection. Wounds of 6 hours old and in need of delay primary closure. Contamination from humans or animals, example bites. Possibilities of inaccessible deep contamination, example puncture wounds. Exposure to damage of deep structures. High fever, which sometimes is a signs of infection. Antibiotics should commence after collection of blood sample culture. Okay, our next topic is assessment. What is assessment? Assessment is a systematic and continuous collection, organization, validation, and documentation of information in other to get a complete picture of a patient and how they can be helped, which is not a part of cardiovascular assessment. Inspection, palpation, persecution, or auscultation. So is a palpation. A full abdominal assessment combines the following in the order. If the abdominal assessment comes, we have to do inspection first, auscultation, persecution, and then palpation. What do you mean by palpation and persecution? Palpation is used to assess rebound tenderness, organs, and masses, and the following information should be included when disassembling mass: size, surface, tenderness, consistence, mobility, and if it has a pulse or not. What is persecution? Persecution is used to detect air, fluid, feces, organs, and masses. What are the characteristics of sounds heard on persecution and their example? For example, if the sound is dull, you can find the dull sounds in heart. Resonant sound you can find in liver and spleen. High present, no normal organ. Tympanic, gastric air bubble. Please take the screenshot if you don't understand this. And the next topic in this book is assignment. So let's read the definition of assignment. Assignment is to direct an individual or a group to do activities within an authorize scope of practice. Assignment describe the distribution of work that each staff member is to accomplish in a given work or period. So, what are the guidelines for planning assignment? Number one, ensure client safety. Number two, be aware of the individual's variations in work abilities. Number three, determine which task can be delegated and to whom. Number four, match the task to the delegate on the basis of a nurse practice scope and appropriate positions description. Number five, provide directions that are clear, concise, accurate, and complete. This is very important point actually. Provide directions that are clear, concise, accurate, and complete. Validate the delegate's understanding of the direction. We have to validate them. Did you understand this or not? Number seven, maintain continuity of care as much as possible when assigning client care. Number eight, communicate a feeling of confidence to the delegate and prove feedback promptly after the task is preferred. Okay, guys, this is the last topic of covering the letter A. Means we're going to do the A, B, C, D like this, all of the book. We're going to read all of the definitions from A to Z in this book. But today we are going to finish the A. So what is AVPU? AVPU scale, which means alert, voice, pain, unresponsive. AVPU is a system by which an ambulance crew, first aider or healthcare profession can measure and record a patient responsiveness, which indicates level of consciousness. This is actually very, very important. It comes in CBT as well and it comes in Oxy as well. This is similar to the Glasgow Coma scale, which assesses a patient response to motor skills, eyes, voice, eyes and voice. The AVPU scale should be assessed using these three identifiable traits, looking for the best response of each. A means if the patient is awake. V means the patient responds to verbal stimulation. P, patient responds to painful stimulation. U, the patient is completely not responding. So what is the meaning of AVPU? AVPU scale has 4 possible outcomes for recording as opposed to the 13 possible outcomes on the Glasgow Coma scale. The assessor should always work from the best A to worst U in others to avoid unnecessary tests on patients who are clearly conscious. The 4 possible interpretations are: A means alert. The patient is fully awake, although not necessarily oriented. The patient will have spontaneously open eyes, will respond to voice, although may be confused, and will have bodily motor function. We refer to voice. The patient makes some kind of response when you talk to them, which could be in any of the 3 component measures of eyes, voice, or motor. Example, patient eyes open. On being asked, "Are you okay?" the response could be as little as grunt, moan, or slight move of the limb, which prompted by the voice of the rescuer. Pain. The patient makes a response on any of the 3 component measures on pain stimulus or a peripheral stimulus such as squeezing the finger. The patient with some level of consciousness, a fully conscious patient, would not require a pain stimulus, may respond by using their voice, moving their eyes, or moving part of their body. Unresponsive, in another word, unconsciousness, This outcome is recorded if the patient does not give any eye, voice, or motor response to your voice or the pain. Now, a fully alert patient might be considered as alert and oriented very well if he or she could correctly identify the time, their name, their location, and the event. Health professionals or paramedics may begin with the IVPU assessment to be followed by GCS assessment if the IVPU score is below A. If they are not alert, then they have to do the IVPU, and if they are not alert, they have to go for the GCS. All the professionals. So the Glasgow Coma scale. What is the Glasgow Coma scale GCS? GCS is more appropriate in this situation than the IVPU scale, which is not suitable for a long-term neurological observation of the patient. What are the limitations? It should not be used for long-term follow-up neurological status. When compared to GCS, the IVPU classification of alertness has been suggested to correspond in the following manner. A. Alert is equal to 15 GCS. If they have voice response only, they will have a 12 GCS. If they have a pain response only, they have a 8 GCS. And if they are unconsciousness, they will get the 3 GCS. So let me do like this so you can take the printout as well or screenshot. So okay guys, we have finished the all the definitions in the CBT, which starts from the A, and I read it for you. If you like it, so we're gonna start from the B, C, D, and we're gonna finish the MCQs as well. Thank you for listening. Good luck. Bye.